I'm coming to you. Dr. Garg, Dr. Seth, I'm coming to you. Narayana now joining us from Hyderabad. Please go ahead.
Yeah, good evening to all. One is that the government is waiting and watching with caution. I mean, the caution can be taken once the ban takes place for the arrivals of the people coming from the infected areas. It could be a knee-jerk reaction, but it has got to be done, and they can watch forever. You know, that is a continuous process, number one. Number two is that the precautions have got to be made mandatory because the people have loosened their, they have become a little more comfortable with the precautions.
Right. People have become complacent. That's right. That's a good point. Can we consider the fully vaccinated population completely safe from the fatal impacts of the infection, Dr. Garg?
If you take 2 doses of vaccine, and the 2 doses you have to take irrespective of your disease condition. That means even if you have been infected, you have to still take 2 doses of vaccine. That means if you have suffered from the infection, then you can take the first dose after 3 months. If you have taken 1 dose before infection and then infection happens, then second dose you have to take again 3 months after the infection. That is one thing. The number 2 part is that at every point of time you have to maintain COVID appropriate behavior, which is being stressed again and again. And there was one question regarding opening of schools also. Please remember, as of now we are talking of a time that where we have to maintain, perfect, we have to be in a perfect safe condition, in the sense that we have to, whatever we can. That means we do not have as of now a single case. Right. But the government of India, under guideline of Ministry of Home Affairs, is doing the testing of all the passengers, and those who are positive, their samples are being sent for genomic sequencing. The focus is also on, containment zones and the surveillance. So testing, treating, tracking. The mantra which is originally was there, which had gone down, we have to put in our systems in place. So that is important. So please remember, the important things are that we need to take the vaccinations, follow COVID appropriate behavior. Do not hesitate to send children to school, because there is no compromise between the real-time education and a digital education.
Well said, ma'am. In the end, Dr. Seth, we don't have much time, but I do want to understand from you, sir, while we are talking about this variant Omicron, where do you stand on this debate about the 3rd booster dose?
So let me just say that there is no debate around boosters. You don't have to take sides because it's a continuum process. There's no doubt that there has to be a focus on double vaccination. And by the way, one thing which got missed out is that double vaccination there still may be an immune escape, and one may actually catch COVID and have breakthrough infections. But what is clearly understood with double vaccination, even for Delta virus, was that severe illnesses were decreased, hospitalization was decreased, and mortality was minuscule, even for the Delta virus in those who were double vaccinated. That may happen for this virus also. By the way, as regard to booster is concerned, the most important aspect is it's not a debate. Clearly the focus is double vaccination, but if vaccines are available and are going to expire, as we hear in the news, or are going to be exported out, then there's absolute a point considering revaccination and boosters, because boosters are going to be required anyway, and are required even in our flu vaccine. So it's nothing new. And perhaps what's happening is that the frontline workers, the hospital workers, the ones who are susceptible, the one with low immune responses, are already nearing, by the way, the 10 months post their first vaccination, post their double vaccination. So actually there would be a time to look at it soon, and maybe this is the situation which arises a relook as to say, if we've got surplus vaccines, yes, we could transfer that into booster dose of susceptible communities like frontline workers, like doctors, and like the ones with low immunity. There's nothing wrong with that. It's just fine-tuning a roadmap. And this is the time to create a roadmap. And the government is already looking at it. As you know, you've already heard that is going to come under consideration, at least for discussion by the experts very soon. And they will guide us as to the right time, should we say. So the issue is timing rather than for or against truly.
Great. On that note, I think it was great having that conversation with all four of you. Thank you for sparing the time and putting out the information. A lot of the queries also answered of our viewers. Thank you. Thank you so much for joining us on debate number 1 on News Hour Special Edition.